Noon, we'll call the meeting on Health and Human Services to order. Madam Clerk, roll call.
Commissioner Marecki,
Here.
Commissioner Baidoon has requested an excuse. Commissioner Anderson. Commissioner Colleen.
Here.
Chair Baker McCormick,
Here.
you have a quorum present.
Thank you. Next item.
B, Chairwoman's remarks.
I think we'll let Darcel Brown, if you had something to say about the water kits, maybe you want to. It's not on the agenda. He just brought them, so we'll just. Have him make a brief remarks about it.
Good afternoon, Natalie Dean Wood, Division Director for Public Health. At the last HHS meeting, the chair requested some water sample kits, and that is what those are.
Okay. So what do we do?
So
Okay.
there is also a document that accompanies the bottle that gives you the directions on what to do in regards to how to collect the water, how to tighten up the bottle, and how to ship it. One thing I do want to make everyone aware of, testing is not free. And depending on how many tests you want done on your water, depends on how much you end up having to pay. The basic test that we're really looking at is the copper lead, and that's about $18.
Okay, and once you submit the sample, how long does it take for them to process usually?
That I do not know, but I can find out for you because it has to go to lab in Lansing.
Okay. And the general public can call,
The general public can contact information on the sheet, as well as they can get information from the website, from our website, and go under lead. And they'll have a whole plethora of information on lead and how to obtain a sampling kit.
right? Thank you. Commissioner Vice Chair Colleen.
Thank you, Madam Chair. So Wayne County really doesn't touch this. This is all done through Eagle.
Right.
Okay, just for clarity. So
Yes, this is done
when I
by
tell
Eagle.
people you can do this.
Yeah, they'll be working directly with Eagle.
Okay. All right. Cool. You can get your soil tested up there too.
Correct.
And so with anyone, so it doesn't necessarily have to be in Wayne County then. This sample could be in
Yeah.
Anywhere
It could be
in Michigan.
anywhere in Michigan,
Okay,
correct.
so it's not Wayne County. Okay. Any other questions? No. All right, thank you.
Thank you.
All right. All right, next item.
Let the record reflect that Commissioner Anderson has requested an excuse. Moving to C, approval of the October 10th, 2023 meeting minutes.
Is there a motion? In support? All right, all right. All those, we can vote. Motion passed. Next item, please.
D, unfinished business. There is none listed.
Next item.
Item 1, under new business, revision of resolution number 2023-689, approving amendment 1 to a 3-year grant with 2 one-year options to renew with Health Emergency Medical Services, Inc.
Natalie Dean Wood, Division Director for Public Health. There was a typo in the document in regards to the line item in the budget that it was identified for. So we just needed to correct the typo and bring it back before the committee.
All right, thank you. Any questions? Oh, next item.
Thank you.
Yeah, we can just do them all together. Yeah.
Moving to item 2 on the addenda. Requesting commission approval of amendment 2 to a 2-year comparable source contract with 3 one-year options to renew with Spectrum Juvenile Justice Services to increase the per diem bed rate from $643.72 to $657.59 for secure detention and residential treatment beds for juvenile offenders in the county.
Good afternoon.
Melissa Fernandez, Director of Juvenile and Youth Services. This is our request for approval for a second amendment with Spectrum Juvenile Justice Services. They provide the secure residential treatment services in a small detention center for the county. The amendment is specific to the per diem rate. The state has increased their rate with Spectrum. Our contract with Spectrum states that we will pay the state rate plus 3%.
Okay. Any questions? Oh, Commissioner Colleen?
Thank you, Madam Chair. So a majority of the increase is being picked up by the state.
Correct.
We get 3%. Does
Correct.
this change the number of beds available?
It does not.
I don't know if this is the time to do it, Madam Chair. Where are we at with increasing beds? Us or the state of Michigan and/or?
So Spectrum, they have 166 beds that they have. Currently, they have 80 kids at their facility. 59 of them are county kids. They are still having challenges with staffing, which is why they still have a whole building that's closed. The state of Michigan has moved towards the rite of passage program, which will take 20 Wayne County kids in a couple of weeks. They were at the JDF yesterday interviewing the kids. We've sent 30 referrals to them. 20 will be heading out by November 1.
And Spectrum takes more kids than just Wayne County, right?
That is correct. They also take state kids.
Take,
State kids.
yeah.
Yeah.
Okay, but right now they're only at half capacity.
That is correct.
Because
Okay.
Because of
the
their staffing challenges.
Yeah. Gee, somebody has staffing challenges? Thank you, Madam Chair.
All right. And we hired a security firm that we were looking at bringing them in as employees. How is that going?
So we're continuing to use them. NPS is our firm that we're using as contractual staff for our direct care staffing. We currently have 80 staff at the JDF that are contractual staff, and we have about 60 that are county staff. We're continuing to roll over contractual staff to county staff, but our position is to continue to hire staff for the county. We've increased our ratio so that we can beat the state ratio. The state ratio requires a 1-to-10 ratio. We are trying to staff our facility at a 3-to-16 ratio. That's where we feel we're safest. So we're continuing to onboard weekly. We have weekly orientations and onboarding.
Okay, and so how is the safety concerns that we were trying to address? Are they?
So we've increased the footprint of the facility. We went from 3 pods to 10 pods. Our census today is 107, down from 160. And so we're working closely with the court in identifying youth who can be released and probably shouldn't be in the facility for status offense type offenses. And so we scrub the list on a weekly basis. So today we're at 107. Now the kids that are there, waiting for placement. We have 40 kids today waiting for secure placement. Those kids absolutely cannot be released in the community. They are a risk to the community. So our ratio, we are in line with our ratio. We are able to staff the building safely, where, a year ago, if you recall, I was sitting here saying that the kids were locked down 24/7. That has not been the case since March. Kids have been out in regular programming and regular schooling and regular activities since then.
Okay, and so no major security concerns at this point?
Not at this point.
Okay, great. All right, thank you. Say next item.
Item 3, forwarding notification of an emergency procurement report for a purchase order with Bob Barker Company for clothing, recreational goods, shoes, and other previously provided dry goods for the juvenile detention facility.
Great. Commissioner Colleen.
Thank you, Madam Chair. So this isn't really before us for a vote, right? This is a receive and file item. For the $1 million of shoes, clothing, etc. And other previously provided dry goods, which would be what?
Clothing, it's all of our clothing, all of our hygiene items, all of our recreation items.
Now, this is done as an emergency, so we maintain some sort of a inventory
We do.
over there? And how is that usually paid for?
The inventory?
Yeah,
I'm
because
not,
this is coming to us an emergency, like, oh my God, we walked in there and all of a sudden we got to get a whole bunch of stuff. I'm looking at what's the
Yeah.
day-to-day, weekend, month in, month out on how we keep track of the inventory, and then how do we generally purchase it? I don't
right.
think
So
we've
that,
had an emergency before.
no, and this came out of the emergency in March. Again, the budget was budgeted for 50 to 80 kids. At that, then we had 160 kids. So we just did not have the supply to care for 160 kids. So that we do inventory weekly. We submit the inventory and we track it. But at the time, we just did not have the inventory for the volume of kids that we had.
And that's been because there was a medical emergency or a medical, what was the emergency declared? Health?
The health emergency, correct?
Yeah. And when did that declaration cease to exist?
I can't recall the exact date.
Well, not exact, but it was 3 months ago.
Yeah, it was about 3 months ago, June, July.
Okay, and now we're down significantly in the number of kids since
Right.
then. Yeah, as you know, Madam Chair, I'm not wild about these emergency receive and file type
Mhm.
things, because can staff tell us when this was submitted to the commission, please?
Chris Albrecht, policy analyst for the Wayne County Commission. Commissioner Colleen, our records indicate that we received this notification, or the commission received this notification on July 6th.
Yeah, I'm doing that counting too.
Mhm.
As I understand the need for emergency procurement, but I also don't want to use that as a tool to run a whole bunch of money through here.
Mhm.
So this conforms with the health emergency as far as staff is concerned, this proposal?
Maybe we'll let our council
Sure.
reply, because that was one of the questions that I
Oh,
addressed.
see.
Yeah, at what point is
Yeah.
this no longer emergency? And
Through the chair to this honorable body, I believe that this was actually procured during the time where the emergency order was still in place. It's just now getting to the commission and then to this body. With regards to the items purchased, because we're talking about juveniles and we're talking about a 24-hour facility, it does seem that the necessity for such items was probably needed and therefore probably justified as an emergency procurement at the time.
so clothing, yeah, go ahead. Mhm.
30 days too late
Mhm.
as far as as far as getting this. It's like 92 days.
Well, if it was received by the commission on July 6th, then it just didn't get processed into this body till now. So that could have been a staffing issue.
Okay.
Because you have an item such as a receive and file, which is not requiring action. Sometimes these items simply are not on the top of the priority list for staff to process when we have other items that they're actually still in need to procure. So some of the delay could have been on our side, just from a priority perspective, as far as from July 6th moving to today.
Madam Chair,
Commissioner Colleen?
just one last
Mhm.
comment. In listening to council, I mean, we don't have, and this has bugged me about other emergency procurement, there's not like a clear line here. Right? That maybe they needed them at the time, so I don't know. On the commission side, how we determine that in what seems to me to be a very clear cut. It was either in during the emergency or it wasn't. I understand there's some of that overlap. But well, hopefully, and with less kids in there now, we've got nice inventory somewhere over there of stuff that'll last a little bit longer until we see the next procurement. But that's just a comment. Thank you, Madam Chair.
And because this was an emergency, it did not go out for bid, right?
Correct. And these are
Okay.
vendors that we use
Okay.
at the facility.
Yeah, because that was my other concern is why for products like clothing and shoes and things like that, we're not purchasing them from a vendor within Wayne County. I'm not sure.
And
But-
Bob Barker is a vendor that we use. They provide the correctional institutional dry goods.
Okay. All right, thank you.
This is right.
Yeah.
Get it?
Yeah,
Barker.
right. Good one. Next item.
Item 4, a resolution by Commissioner Baker McCormick expressing a collective belief that municipalities should have the right to enact regulations that are in the best interest of their residents and the environment, and strongly urging that the Michigan Legislature and the Governor support Senate Bill 228 of 2023 in order to allow for local jurisdictions to regulate the use of single-use plastic containers.
And basically, that's it as in a nutshell. We want to ensure that we have the ability to regulate if we want plastics or how we dispose of plastics in our community. Right now, we don't have that control. And so there's a Senate bill that addresses that issue, and being that we want to look at sustainability and in the future in Wayne County, I think this is a start. Yeah. Yes.
So I read through it. So are they purposely doing that at this time to give local control?
back.
Okay,
to
so it's,
local.
this is what they're really aiming for in this. I mean, there was a lot of information before, but yeah, I'm all for local control.
Mhm. Yeah,
Sounds good to me.
Commissioner Colleen.
Yeah, what's currently in the law that's preventing local communities from doing this?
So there is a law that basically states that the state of Michigan regulates local municipalities as far as single plastics are concerned.
Wow,
So,
there's a
yeah,
specific law that says that.
it is. It is. And so that
Does
this,
it enumerate anything else besides these containers? Or was it specifically aimed at this to say the state's going to do the regulation just on these items?
I can't recall, I don't know if our staff attorney can recall what the law clearly states to prevent us from
Well, If
local
we can get a
control,
copy
but
of that law, because if it does regulate other things, that would be interesting to look at too.
Mhm.
Because I think the principle generally is locally, you can't have regulations that are less lax than the state or the feds. But if you want to have tighter regulations, you can. I think that's generally,
Opposite.
is,
Through the chair. So we did look at this resolution. There is currently a state law that says that local municipalities cannot regulate single-use or reusable plastics. And they list several items, like clothing, paper, plastic. And this, I believe it's all related to the transporting, consuming, or protecting food or beverages for food service or retail facilities. So it's somewhat specific with regards to what it says. This proposed Senate bill seeks to repeal that particular state law. Now, what I don't know is whether there are other state laws out there, like Commissioner just mentioned, that actually state this is who regulates it. Because that's not what the current provision at hand is discussing. It simply says locals cannot, but it doesn't necessarily say who can. So whether there are other state laws out there that will come into play once this is repealed, I can't speak to, but this is simply seeking to repeal that specific law that specifically says locals can't do it. But again, there could be other things that could restrict locals' ability to do so, or says the state does something or another. I'm not sure.
Commissioner Clean.
Yeah, thank you. What was the year of that law, Counselor?
It was 2016 and my office provided it, and I don't know if it was in the,
Was attached.
it was attached.
Oh.
Okay, so it's a really short, like, page
Yes,
law.
really
It's like one
short.
page.
Yes.
So it should be in your package.
Yeah, I looked at it, but I forgot to check the date. 2016, that was
2016.
basically yesterday.
Mhm.
I'd be real curious as
Oh,
to
I didn't
the,
even know it was in our
I'd be,
packet.
I'd be
Okay.
real curious just
Mhm.
for myself. What was the politics that drove that at the time? To say,
Probably money.
It's always.
my
money.
question, Madam Chair, is whose
Oh,
money?
whose money?
All right, thank you, Madam Chair.
All right, well, thank you. Any other questions, sir? No? All right, next item
We need a motion for items 1 through 4.
is,
Chair, if I may, to receive and file.
I think it was just two,
No,
no, let's see.
three. Receive and file 3 for the emergency purchase. And approve. 1,
Right.
2, and 4. That's my motion.
Is there support? Is moved and
The only
it's
other person
supported,
can
yep.
support.
We can vote. All right, there's no abstentions and no votes, so motion passed. Next item.
Item 5, discussion by the Department of Health, Human and Veteran Services reporting on its COVID-19 contracts and its outreach services provided.
Good afternoon, Avni Sheth, Division Director of Clinical Care Services, HHVS. I'm going to provide you a brief update on COVID-19 and where we're at in terms of the trends, and share a bit more about our community efforts, community engagement efforts, and some of the work that we are doing through various different partners in the community around COVID-19. So the first slide, well, we have tech up too, so that's good.
Before you go on, how do the contractors that we have report back? Is it like a weekly, monthly? What does the reporting look like to you from our contractors?
Sure. So we work with Authority Health, who kind of manages all the partners around that specific grant, the Catalyst grant that I think you're speaking about.
Yes.
And they report kind of regularly, but we definitely do some intentional gathering during our quarterly reporting periods. So, every 3 months, we kind of gather all the information. We have a reporting tool that they all use that feeds into our reporting and some of our evaluation work.
Thank you.
Mhm.
Right ahead.
So in terms of COVID-19, I think you all are aware of where we're at right now in terms of statewide trends. We're generally on the decrease at the moment after having what I would call a wavelet, so a small increase in cases kind of around September, late summer, which is the usual trend that we've been seeing with COVID-19, with a kind of a wave in the summer and then another wave in the fall and winter. So we're kind of coming down from that and headed into into the fall and winter season, we know that cases, so the graph on the left is our case trend since the beginning of the pandemic. We know case reporting has significantly decreased through the entry of at-home testing. And so, but we still look at case trends, right? Because it shows us when we're kind of expected to go up and down. On the right side are two graphs that kind of just illustrate where we're at right now with COVID-19 and the progress we've made since the pandemic. So the top graph is hospital admissions in the state of Michigan since really the onset of the pandemic. And the bottom graph is our weekly deaths in Michigan since the beginning of the pandemic. And you see each of these peaks represent a wave that I'm sure you all kind of recall and remember, usually had to do with the emergence of a new variant that kind of triggered a wave. And you saw that in response, we had a significant uptick in hospitalizations and deaths. We haven't really seen that since we had the initial Omicron in December and January, so 21, 22, when we really saw case rates, hospitalizations, and deaths really increase with that initial Omicron surge. And the kind of smaller waves that we've had since then have had less of an impact on what we worry about most, right? People getting seriously ill, going to the hospital and dying from COVID-19. So you can see that though our case data is not as accurate anymore because we're not capturing all the cases, the hospitalizations and the death rate really paint a picture of where we're at, right? We've made a significant progress, and that is mainly has to do with our immunity wall we have as a community through vaccination. And now most of folks have had COVID at least once. And kind of that immunity protection we have at the community level is really keeping the impact of COVID-19 at bay as these new variants emerge. And so the next slide.
I'm sorry. Is this Out County? From what is this from the data? What's the span that we're working with here? The cases and the deaths.
The cases and deaths. So it's a curve from the beginning of the pandemic. So it kind of shows through the, now over 3 years. And mainly, I know you can't even read the numbers and letters on the side. It's mainly to illustrate the kind of the trend that we saw. Exactly, the pattern.
Okay.
And that's really the most important point from that.
But the 5,219.
Yes, so that's the cumulative deaths in Outwayne County we've had since this COVID-19 has emerged.
Okay.
Yeah. And the low is our current community level in Outwayne County in terms of how we're measuring community risk, which is mainly through our hospitalization metrics. Okay, and then this next slide is kind of an outlook into what we anticipate in the fall and winter. And, with the COVID, it's, we don't want to predict too much because, a new variant that is, virulent or significantly changed from the past could really change everything, right? But what we're seeing now is that in the fall and winter, it's not only COVID-19, that's the main message, right? We have flu and we have RSV. And these three viruses are responsible for the vast majority of hospitalizations due to respiratory issues. So there's a gazillion other cold viruses, right? These are the three we worry about most because this is what sends people to the hospital. And so when we go into fall and winter, we're not only dealing with COVID, we're dealing with flu and RSV. And we know with flu seasons, you've all been through rough flu seasons and easy flu seasons, right? And so we're going to see that trend with flu, with RSV and COVID. Towards where we had a kind of a moderate wave that didn't necessarily significantly impact hospital capacity, disrupt our social lives. But people got sick, more people got sick. Most people ideally had a mild to moderate cold and did not have to go to the hospital. But, we are looking at what flu and RSV look like. So scenario A, I know there's a lot of, I'm just going to lift up the big points. Scenario A is if we have a moderate COVID, flu, and RSV season, where we would be at. And scenario B is, let's say it's a severe flu and RSV season, and we still are a moderate COVID-19. And that's just to illustrate the point of we can't just look at COVID, we have to look at what these other viruses are doing. On the This is the first season, though, we have vaccines against all three of these major viruses, and we didn't have that before. We have the COVID vaccine, we have the flu vaccine, and now we have the RSV vaccine. And so this table on the right basically summarizes the everything that's available and who is eligible for each one of these vaccines. And so this is the message that we're pushing out, is that what type of season we have is somewhat dependent on how much we get in terms of engagement in folks coming out to get the vaccines that are recommended for them. So flu, everyone 6 months and older. COVID-19, everyone 6 months and older. Flu, there's a new vaccine every fall. COVID-19, we rolled out a new vaccine this fall for the 23-24 season. Now RSV, there's a vaccine for the 16 and older and pregnant persons. And these are the groups we worry about most to get hospitalized with RSV. And then the infants, there's a protective antibody that's being rolled out. We can go to the next slide.
Yes, Commissioner Colleen.
Does Wayne County Health Department have the RSV?
We don't at this time. We will be rolling out the one for the infants, but that is still getting rolled out. We have the RSV. It's not really a vaccine.
Looking at that 60 years old.
It's an
or older.
antibody. Yeah. So for adults, we only carry the vaccines that are for this state program. It's kind of like vaccines for children, but for adults. So it's the adult vaccination program. So we only carry a very limited number for adults at the health department.
Can people get the RSV through their doctor or
Yes,
their?
and so, yes, so that's the message, is to see their healthcare provider, because RSV does require, a healthcare provider just to have a conversation with you to see if you should get it, basically. But
Okay.
it's generally recommended for 16 and older, and then all pregnant persons.
Now, it was reported in the last, week or so, and I don't have it straight yet. Is there kind of a shortage of the COVID-19 jab, as it were?
Yeah. So I wouldn't say there's a shortage, but I'm going to be talking about this in one of the slides. I think 2 slides down.
Okay,
About,
if you're
yeah,
gonna get to it,
yeah,
then
it's
get to
mainly
it,
has to
but,
do with the privatization of the COVID-19 vaccine, and
Yeah,
that rollout
okay.
has been a bit clunky.
well, I'll wait till the context for
yeah.
what, I wasn't sure if it was coming back later on.
Yeah.
All righty, thank you.
So,
Marissa, you had a
Just
question?
one
oh,
quick-
sorry.
Because I can barely read this.
Yeah, that's okay.
But the antibody,
Mhm.
so you were starting to explain that's not coming out for a few months?
It is getting rolled out right now, so it will be coming, not a few months. It'll be coming out soon, but it is a new rollout. And so there has been, in terms of getting all the logistics straightened out, and
Is it a shot?
it's yes. So it's yeah, and it's mainly for infants. Yeah. So we're going to be giving it to them during their newborn visits. That's, you may remember last fall, we had tons of pediatric hospitalizations from RSV. And it's really those little ones that are getting really sick. So.
Okay, thank
Mhm.
you.
And just to clarify, RSV seems like it's a new, I don't know, a new virus, I guess. And it just seemed like it came out of nowhere after COVID.
Mhm.
But maybe not. I just
Yeah.
didn't hear about it like we're hearing about it now. Where and how, where did it come from?
So I think many people share that kind of feeling, because it kind of came with like a new surge just last year. But RSV has been there for quite some time. It has been every fall and winter. You talk to any pediatric emergency room provider or hospital provider, and they'll say, we just get so many more kids in the fall and winter with RSV. So they're used to dealing with increases of RSV every fall and winter with kids. However, last year, and it could probably have to do with some of the dynamics with the pandemic and what it caused, we did see a significant increase than in prior years. And I think what we felt was this combined impact of all the respiratory viruses kind of surging at one time and impacting our kids and the hospital system. And so I think that's why it felt new, because we were talking about it in the community so much more. Everyone, was talking about it on the news. I know, I'm sure in the community, those with little ones were talking about it more because it just played this dynamic with the COVID-19 virus, and then
Yeah.
kind of the whole thing is kind of like that balance, and we just don't want to go over that balance, right? And so I think this, especially I'm really excited about the protection for the infants with RSV. I think that's going to be a game changer.
Thank you.
Mhm. And typically, healthy adults really don't get impacted by RSV. So that's why, it's really the really young and the older ones. And especially those with chronic conditions. Okay, so, and I know that I reiterate this message all the time, but vaccination continues to remain the best way really to protect us from serious illness and death. And so I just wanted to highlight the point of, we were very good at pushing out that primary series when it rolled out. Everyone really, we couldn't get to people fast enough. They were lining up. 65% in Outwayne completed that primary series, 2-3 years ago when that was rolled out. But what is considered up to date is it doesn't matter if you got that primary series. It's really getting, like the flu, every fall and winter, that COVID-19 quote unquote booster. And with the last year, we only really hit 17%. And that's compared to state and national. So we're not doing any worse than anybody else. But there's a lot of room for improvement and messaging around this. There's a whole group that wasn't intentionally not trying to get it. They probably thought they were good, because they got that full series, and then there was 1 or 2 boosters since then. But really it's getting that updated booster because the virus changes and because protection decreases over time. And so I just wanted to highlight on the right side all the work that we're doing at the health department with really pushing out doses. You'll see our, doses administered, our various community clinics that we've been holding, especially in the schools, which has been great because we do that, plus all of the routine childhood immunizations and get all the kids up to date. And then we are in the community, we're going to the jail regularly. We're going to senior centers and long-term care facilities, pop-up clinics. We've been trying to go wherever they wanted us to come to take advantage of an opportunity to get an additional folks up to date with their vaccines.
Are they still free or no?
So that's what I think it's the next slide.
Oh, great.
There we go.
Okay. Great.
And this goes into Commissioner Colleen's comment too. So the big change I know it's been painful a bit, and this is a big shift. The vaccine is privatized now. So this is, up until now, the feds were purchasing all the vaccine supply that was going out everywhere, right? Now it's gone, what normally happens with vaccines, right? Vendors are purchasing them from the manufacturers, and then various different entities are buying the supply and then getting reimbursed, right? This is how all vaccine works. So now this is kind of going through all the kind of issues we have with our fragmented healthcare system anyways, right? So it's health plan reimbursement and what covers what. The good news is that it is a bit fragmented and the rollout has been clunky. The good news is that it should still be no cost for everyone for now. So, private health plans, the vast majority cover this fully. There's a few oddball health plans that may not, but the vast majority of private health plans cover it no cost. Medicaid, Medicare covers it no cost sharing. Uninsured adults, there's a program that the feds and CDC rolled out called Bridge Access Program that is covering the cost of if you have to pay for vaccine because you're uninsured or you have one of these, not typical health plans. The feds are covering the cost through December 2024. So that's called the Bridge program. And then we have a great program for children called Vaccines for Children that cover all vaccines. So I know it's busy. You don't have to worry about this. It just shows that it's going to be going through each different health plan or this Bridge program to get reimbursed. And that's been the clunky rollout because people are saying, oh, I have Blue Cross Blue Shield. I'm going to a CVS. And the system didn't really update. And they're saying, oh, we don't cover the cost. And so there's been a little frustration in the community. I'm hoping those things get ironed out very quickly. But, for everyone, it should be no cost for now. We can go to the next slide. It's about 110 to 130 a dose, so it is, prohibitive, right? So health plan reimbursement is 100% plus any administration costs, so everyone will recoup their costs, but there is an upfront cost you pay. So again, everyone has access to these vaccines right now. It's recommended for 6 months and up, but not only is it privatized, the strategy for vaccine access has also pivoted, right? And so before the health department, we would say, everyone show up, don't worry, you don't have to bring anything, just come and we'll give you a vaccine. Now the push is that everyone goes to their healthcare provider, their pharmacies to get the vaccine. And the health department is really that safety net, right? So we have vaccines for the folks that don't have health insurance or don't have really great health insurance and the children. And so that's what our doses are for. And everyone who was used to coming to the health department, we kind of have to remessage and say, hey, you really have to go to your healthcare provider or CVS, Walgreens, that kind of access point. That was the point I wanted to make on the bottom. Commissioner Colleen?
Yeah, I'm just gonna add to that point a little bit. You say that the private folks are buying them. And then selling them where they recoup their cost.
The private folks. So a healthcare provider
Yeah.
will just purchase through their usual vaccine vendor,
Right.
and they'll bill the health plan of that individual.
Yeah,
Mhm.
plus a little bit more to cover their costs for
Mhm.
what they bought them for.
Correct.
To that, I will add, there's probably a few more dollars on top of that. They're just not
Yes.
covering their costs. They're also making some dollars
Profit. Yeah.
off of it. Thank you, Madam Chair. Just for the complete picture.
Mhm.
Thank
You go to the next slide. I'm sure you guys aren't looking here, but just in case. So here, again, so, though our strategy for vaccination as at the health department has pivoted a bit, our job really is to make sure everyone has access to the protections to keep themselves safe. And so as we head into the fall and winter, vaccines, tests, treatment, masks, this is just a, example of some of our numbers in terms of pushing out masks and test kits. We know that also has been challenging, for people to get at no cost as well. We are still providing them at no cost to everyone. And so it's really like making sure everyone has everything so they can, deal with whatever comes. This is just one of our events with emergency preparedness and our nursing staff out in the community at a senior event, passing out masks, vaccines, and passing out test kits. And then we have, and the next slide, as part of our the Catalyst program that was spoken about earlier, we had the opportunity to push out a vaccination campaign for the fall and winter and timed it pretty well. It rolled out in the beginning of October to really kind of get people engaged in thinking about COVID-19 and vaccination again. And so we do really the Catalyst program is specifically about targeting those folks that are disproportionately impacted by COVID-19, may not have the same access, may not have the same capacity really, to think, okay, I'm just going to pop over to CVS or my private healthcare provider and get a vaccine. And so we have, you can see in English, Spanish, Arabic, Bengali, really targeting our outweighing specific communities with the print, social media, radio. And so that got pushed out. And then the call to action really is to find a place to get vaccinated. And then I'm going to go a little bit more into the Catalyst project. And so we're in the community doing these community test kits and masks distribution and pushing those out to all 42 of our municipalities. Anybody who requests it, we have a link for any community organization who wants test kits or masks to request them from and we'll push them out to those folks. And then we have a specific program, Wayne County Health Catalyst for COVID Care, Community Access, Response, and Equity that we talked about before. We brought the grant to this body before and some contracts associated with this. But going a little bit more into like the content of that program, really this is this was kind of started in the height of the pandemic, right? And this is really a community effort, a community collaboration, a coalition that formed around really improving the capacity of these organizations who are on the front line. These are the trusted messengers. These are the folks that are seeing people through various different services and events that they have. If we can increase their capacity to engage these communities in COVID-19, we call it vaccine confidence. So, if those folks that may be a bit hesitant about it, how can we speak to them? How can we message them to increase their engagement into uptaking on the vaccine? And also just, pushing out culturally tailored messaging to these populations that will resonate. I see this as kind of prepping us for the future, right? We increase capacity of these community organizations that when something else comes through, we're ready to go, right? And they're ready to go. And so this is just a snapshot, high level snapshot. There's 17 organizations. One big component of this initiative is, I don't know, can we go to the next slide? One big component of this initiative is health literacy training. So we're training all these community partners in health literacy tactics. So motivational interviewing and messaging and teach back and all of that stuff. They're holding community events kind of ongoing in their various populations they serve. And so far have served about over 12,000 community members through efforts from this grant. You'll see all the partners on the bottom that we have. We have a diverse set of partners, multi-sector partners. Mishwa, I think is there. Yeah, Mishwa is our Michigan Community Health Worker Association that's really supporting as one of the backbone partners and training and doing CHW certification with these partners who have hired CHWs through this grant. We have the next slide.
Before you
Yeah.
go on, so the flyer here about the health literacy training,
Mhm.
that goes directly to the organizations, not to the community. Is that correct?
That's correct.
Okay.
And so it goes to the community organizations and any partners.
Okay.
And so it's really like the staff really that are and the community health workers that that are working on this. And even our, many of our health department staff join this training as well. And it's really increasing their capacity to be, on the ground, on the front line, putting out effective messaging and interventions. And then we have, this is just a little highlights of some of the work the community groups are doing. And then you see the top right, Access did a focus group with a few focus groups, just gathering information on vaccine hesitancy local, right? Hyper local information, like what are you really thinking about? What are you worried about? That was very interesting in terms of what their views are and how, why they may not be so excited about a COVID-19 vaccine. I think that helps them as an organization, how to speak to those issues. There's also one of our partners is Mario Morrow and Associates, who do this really great street teams canvassing training that really improves the capacity of these community organizations to do that door-to-door outreach. And so this is just a snapshot from their training that they did on canvassing that many of the community groups then went on and implemented efforts around that.
So for any events around education, health literacy, are those on the Wayne County website, or where will we
Mhm.
find or see those types of events or communication?
So they're not on our website. These are kind of ongoing. The partners are doing their own communications through their platforms. So we collect this information when we're doing our reporting and evaluating, but it's mainly the partners are, pushing out these events and fairs and
In their circles.
in their circles,
Okay.
exactly. There's one community group that's really, in the faith-based sector and, in the churches and kind of doing various different things there. And so we gather this information so we can summarize it and analyze it. But yeah. And then I have, this second one is just more deeper dive into the Catalyst, just update. So
Right.
for your purposes.
Thank you.
Mhm.
Any Commissioner Colleen?
Thank you, Madam Chair. I was just up on 32 this morning getting my double jab.
Oh, yeah, you reminded
And-
me to remind everybody about that.
Pardon? Yeah, because there's more dates available. I
On
think.
Thursday, we're going to be back at the Guardian, 10
Yeah.
to 2.
Now, that was a combination of Wayne,
Mhm.
I forget what they call them. They go around.
Wayne
with the
Health,
name.
yeah.
Yeah, Wayne Health. And Wayne Health had the COVID,
Mhm.
but the county was there also for the flu vaccine. Can that be taken on the road? To go to events where we can have both the,
Mhm.
okay,
We.
and is that limited to out county Wayne? Can it be in the city of Detroit as well?
So Wayne Health, as you probably are aware, they have a significant Wayne Health mobile unit and programming that I think really took off during the pandemic, but they're continuing to be out in the community. I think there's more opportunities for us to partner that we're going to explore with them on. But they regularly are in the community doing various different vaccines and other services and wraparound services.
And then for this discussion with providers about how to discuss with people.
Mhm.
Do you know if we're working with the Unified Detroit Coalition that does health fairs spring and summer? They're getting their schedule together for next year. Do you know if we're partnering with them both for being able to provide this? And
Mhm.
maybe I should talk to Wayne Mobile
Right.
at those health fairs, and I think they're all in the city of Detroit. But also for their people to get trained on
Mhm.
how to have this conversation about vaccines. So are we, or are you interested in being in touch with Junius over at the Unified Detroit Coalition?
Yeah, I'm absolutely interested in kind of connecting and seeing if, even some of these trainings that are going to be ongoing through at least June of next year.
I'm aware.
Make them aware and share. This is all, we like to widely share these trainings, not just to the folks that are on the grant, but it's for the wider community right now. And so, yes, please
I
send that
will, Sarah,
information
will share
along.
Contact with you.
Sure.
Thank you. Thank you,
Mhm.
Madam Chair.
Mhm.
Thank you.
Thank you.
All right, Madam Clerk, next item, please.
F, such other matters as may be properly submitted before the committee.
There are none. Next item.
G, public comments.
Are there any public comments? Any emails or anyone on Zoom?
No emails were received and no hands are up on Zoom.
Right. Next item.
Adjournment.
All right.